Welcome back to the Holistic Travel Therapy Podcast. I am your host, John Wilson, Doctor of Physical Therapy.
And I'm your host, Courtney Condon, occupational therapist. Thank you guys for tuning in to this next episode. We, first of all, just want to thank you so much for such a great feedback that you guys have given.
Yeah, the support has been crazy, definitely. Even just one episode in, we really do appreciate everybody who's reached out, everyone who's commented on the video, and just texted us outside of the
that's
video
been huge, guys.
Said what they were doing, and they listened to it, and that was just so great to hear.
Yes. So thank you from the bottom of our hearts.
Definitely.
Now, getting into our next episode, we thought that we'd come to you today with some information on injury prevention. We see injuries in both of our settings as occupational therapists and physical therapists, and they're presented differently throughout the lifespan, right? So John has a lot of expertise with working with injuries in sports and performance from all ages. And then we think about even our injuries as we get older and we increase our risk for falling and breaking a hip, breaking a shoulder, breaking, another bone, and the rehab after that. So we thought we'd come in, just tell you a little bit about our main focuses on injury prevention.
Yeah, there's nothing worse than being in pain, and that is what we deal with all the time. Of course we do, strength, balance, all that extra stuff as well, but being in pain is the worst. And, we've been doing this. I've been a physical therapist for about 7 years now, so it's definitely tough at times because, everyone is coming to you with their pain, and it is your job to help them. But wow, it's very rewarding when you see people coming back and they're like, wow, that really helped. So I just kind of wanted to talk a little bit about what I see in the outpatient clinic, mainly low back pain. Back pain in general is huge. I'm sure 75-80% of the viewers out there have had back pain at least once in their life, and I see knee pain, I see shoulder pain, but back pain is definitely the number one. Back pain's tough because, the spine goes all the way from the cervical spine to the lumbar, so it could, be anywhere. But the big thing with back pain is usually with bending, lifting, or twisting. So a big thing I like to tell people is the BLT, just try to avoid, BLT, especially in a quick motion, because that's how you're gonna, rupture a disc or tear a ligament. And there's so many different things that could happen, strain a muscle, sprain a ligament, anything like that. So you want to just take it easy as far as lifting. Everyone always says lift with your legs, which is definitely true. But yeah, big BLT, you want to try to avoid those movements if you have any back pain or if you have any weakness in your core or in your upper back. Just try to avoid BLT.
Yeah, so it all focuses on your body mechanics, right?
Definitely.
How you perform those actions is going to directly impact how you feel, your risk of injury, right? So if you are lifting overhead with poor body mechanics, that's where you see a bunch of shoulder injuries, right?
Definitely.
So, even standing up for long periods of time and working overhead, you might be cleaning your gutters or, working in your house, but if you're doing that with poor body mechanics, then that's where you're gonna get your injury, right? And the same thing with the athletes. If we are performing a movement over and over, pitching a baseball, for example, shooting a basketball, and we're doing that with poor body mechanics, that's where we also find our injuries.
Definitely.
So, that would be my number one thing to say in the beginning, is you wanna focus on your body mechanics. Whether you're lifting a box and putting it overhead, or you are going out on the soccer field or, baseball field, making yourself aware of the movement that you're going through.
Definitely. And then we talked about this a little bit the other day, but it's really just a balance. You want to have good body mechanics, but you also want to have a good balance between strength and flexibility. So hypermobile versus hypomobile is kind of what we call it. If you move too much, or if your ligaments and your muscles don't move enough. So a great example, and number one thing that I do for knee pain is a quad stretch. So I do it. I have the patient lay on their stomach, and it's unbelievable to me. 99% of people coming in with knee pain, it's either one or the other. Either their knee will bend, 100 80 degrees basically, completely to the other side, where they're so hypermobile. Their ligaments, their tendons, everything in their knee is just moving way too much.
Yeah.
So their knee will bend and they won't even feel a stretch. I'll put it all the way to their butt, and then you can take it even past that, and it's
crazy,
unbelievable. And usually I see that in like the younger athletes,
right?
Younger soccer players, definitely. And then there's the other side where usually in the older, like 40s, 50s, 60-year-olds, it doesn't move at all. Maybe it gets to 90 degrees, but then they're like, "Oh, like that's too much. That's a lot of a stretch."
That's a big stretch.
For those people, I would focus on stretching. Definitely, look up good stretches to do online, or of course you can reach out to us if you have pain anywhere. We have, great stretches that we do every day. And then the individuals who maybe move too much, definitely focus on strengthening. Because if you move too much, that is how you're going to tear your ACL, because if you plant and you move and your ligaments used to that, or your muscles used to that, it's just going to continue to go until it snaps, which definitely, you want to avoid. So any athletes out there, if they're too flexible, maybe not strong enough, just work on the stability aspect. So. And
then in the reverse, if you have too much strength and not enough motion, that's where you're going to put yourself at a risk for impingement, right? Like a shoulder impingement, that you are overtraining to the point where that muscle is getting impinged.
Oh, definitely. I see a lot of guys coming in training chest, training chest a lot, and then
that's huge.
Their chest is just so tight, or their biceps is so tight, so it's kind of like right in here. This tendon right here just gets impinged. So a lot of people come in with shoulder pain, they have that impingement. So doing stretches for that as well is super important.
Yeah, so, like John said with the knee, finding the right balance between having enough range of motion in the knee and also having enough strength in the quad. So we're saying same thing for shoulder, like, making sure that you can have as much range of motion and then strength within that range of motion. And then same thing for back pain, right? So like if we're not flexible enough and we're trying to like bend down and grab things, we're putting too much strain on our body, that's gonna cause that injury as well.
Yeah, it's crazy that.
So that perfect balance.
I would say most people with back pain, just from my experience, they actually come in and they are hypermobile. So their lower back, and you would think that it's like, oh, my lower back is stiff, blah blah blah. That's why I have back pain. It's really the opposite. It's like it's not stiff. It's not strong enough. So it's like if you do a movement like bending and picking something maybe 20, 30 pounds up. Moving boxes or something's huge, moving furniture, like so many people with disc, herniations through that.
Yeah.
But doing stuff like, I love planks. I think planks are just perfect stability because it's an isometric, which basically means that you're not moving.
And you can really do it anywhere at any age. It can be adapted to fit your fitness needs, and it's free, right?
Yeah.
So if you feel like you're suffering from back pain, shoulder pain, knee pain, really it all starts in the core. So it's a great place to start. And then kind of figuring out from there, like where maybe am I lacking range of motion? Where am I lacking strength? Consult, of course, your doctor. Maybe see if you can get referred to physical therapy. Like John said, if you have questions, you can definitely reach out to us. But it is all about finding that balance.
Yeah, and it's crazy the amount of people that always say like, oh, like a lot of people come to physical therapy because they have to. Their doctor says, I'm not going to give you an MRI until you do, 6 weeks of physical therapy. And they all come like, oh man, like I got to go do this and do that. And then most of them, again, there's always a few, but most of them come back after the first, second session. They're like, wow, like, I believe in this now.
Better.
And it's really just, giving it a shot. Again, some people need 6 to 8 weeks of physical therapy. Other people just need, a few exercises here and there, listening to us, reach out to us. We'll definitely,
So we're closing in 5 minutes.
5 minutes? All right, thank you. We'll definitely, be here for you. And, before we get kicked out, anything else you have to say?
No, I think that was perfect timing. I think we
were just finishing up.
Yeah, that's what I was like. But hopefully you guys get some takeaways from this. As always, if you have any questions, please reach out to us. We appreciate you tuning in, and
I want to hear in the comment section, throw in, your favorite exercise, or maybe anything, that you're maybe dealing with, and maybe stretches that help you. So just, let us know. We always love to hear what you guys have to say in the comments.
Right, yeah. We want to learn from you guys as well what you're dealing with and maybe what you've used to help you get better. So thank you so much.